As Oregon lawmakers consider raising taxes on alcohol next month, an Oregon Health Authority report about the impact taxes have on drinking habits is drawing a whole lot of controversy.
This report was actually finished back in 2021, but it was not released until this week. Brandon Thompson here now after digging deeper into the report. And Brandon, what exactly took so long?
That is an answer I've been trying to get out of the Oregon Health Authority all day. Now, the Oregon Beverage Alliance believes that OHA hid this report because they think it undermines what OHA has said about alcohol tax increases. Many studies have shown that tax increases lead to varying levels of decreased drinking, including the report in question here. Oregon has not raised taxes on beer and wine since the 80s. It's been an issue every legislative session for the past several years and is likely to come up again this session. A report for OHA, authored in 2021, just released this week.
It's an important report. It has great data in it. And now it's become controversial in and of the fact that it's sat on a shelf.
The report, released only after the Oregonian first reported its lack of public access, a delay alcohol industry groups like the Oregon Beverage Alliance believe is deliberate.
The report certainly undermines much of the public messaging.
The study looked at alcohol's effects in Oregon, including the effect a proposed tax increase from 2021 would have had on alcohol consumption. Sarnoff Wood says one of the recent proposals would have put him out of business.
It would have been millions of dollars to my business, more in taxes, more in fact than my business made that year.
The OHA report found overall the increase on alcohol taxes would reduce consumption by up to 4% and up to 2% for heavy drinkers, though everyone may turn to cheaper alcohol like spirits no matter what.
It was very clear that if you raise the price of alcohol, you reduce harmful consumption. Less so with excessive drinkers, but definitely with moderate drinkers.
The report notes a similar percentage decrease in Illinois when that state raised alcohol taxes. But as the debate is likely to return to the State House this year, Marshall points to a more recent example in Maryland, where the National Institutes of Health found a 6% reduction in drinking after taxes increased in 2011.
Oregon has the second highest addiction rate in the country, fifth highest alcohol use disorder rate. We've got to get those numbers down.
So Marshall takes issue with the assertion that this was deliberate, saying the report would not have changed the last 5 years where an alcohol tax increase has failed in Salem. So there's going to be a meeting next week discussing this in the state capitol.
And I know you'll follow up on that.
That's right.
Yeah, thanks, Brandon.
And we're just getting started.